Cosmetic surgery, like other forms of elective surgery, involves a physical change to one's appearance. Also known as plastic surgery, there are two kinds: cosmetic and reconstruction. The latter involves returning an individual's sense of self after some form of injury and/or illness. The former allows the ability to overcome the physical characteristics one was born with. In a way, the former represents the forefront of how changes in technology can allow changes to the human body. This surgery comes in all types. From the use of prosthetics as in breast augmentation and liposuction to non-invasive forms of surgery, like laser hair removal or even laser correction of the eyes. To eliminate the need for eyeglasses. None of this comes without a price, however. Besides financial concerns, it remains the responsibility of the individual who will undergo such surgery. For this reason, they do need the support of those around them. This is the kind of support that not only affects their decision, but their ability to assimilate the surgical changes to the body. In the case of surgery for cosmetic, as opposed to reconstruction, purposes is the issue of aesthetics. Those around them need to understand the significance societies place upon appearance. How the appearance of someone can alter how they are perceived not only as a person, but as a human being. Surgery for aesthetic reasons provides people with the opportunity to overcome stigmas associated with their appearance. However, what remains most important is that it's a choice. Many perfectly valid arguments have been presented to the contrary regarding surgery for cosmetic purposes. However, the fact remains that human beings have been altering their appearance for quite some time now. Cosmetic surgery is significant, not only for what it can achieve, but because it's a choice made by the person undergoing it. It's a personal decision about one's own body. Another consideration for the individual, outside of their support system, is that they should do as much of their own personal research as possible into the different kinds of surgery available for each procedure. For example, the current surgical techniques employed and the potential legal restrictions, as it's often the case with silicone prosthetics. In addition, weighing the pros and cons of each technique. Finally, the surgeon themselves. An initial consultation is always recommended. As with any form of elective surgery,
the common sense approach to acne treatment. The first thing to remember when starting acne treatment is that there is no overnight cure. The duration of treatment can last between a few months to a few years. Another thing to understand is that what may work for one person might not work for another. Each individual is unique and the effectiveness of treatment varies from individual to individual. Also, it is always a good idea to follow the dermatologist's advice. There is no point in trying remedies at home and ending up treating complications due to the home remedies. Let nature run its own course. Most acne cases usually settle down over a period of time and treatment can only accelerate the process, but there is no substitute for Mother Nature when it comes to healing. How should people go about acne skin care? This video enumerates some basic guidelines to go by. For example, you should clean your skin gently, avoid frequent handling of the skin, avoid sun tanning, and lastly, women should choose their cosmetics carefully and men must shave carefully for good acne skin care. People with acne may try to stop outbreaks and oil production by scrubbing their skin and using strong detergent soaps. However, scrubbing will not help acne skincare. In fact, it can make the problem worse. Most doctors recommend that people with acne gently wash their skin with a mild cleanser for acne skin care, once in the morning and once in the evening. Patients should ask their doctor or another health professional for advice on the best type of cleanser to use for acne skin care. Acne skin care also means washing your skin after heavy exercise. Patients should wash their face from under the jaw to the hairline. Rough scrubs or pads should not be used. It is important that patients thoroughly rinse their skin after washing it. Astringents are not recommended for acne skin care unless the skin is very oily, and then they should be used only on oily spots. Doctors also recommend that patients regularly shampoo their hair as part of acne skin care. Those with oily hair may want to shampoo it every day for proper acne skin care. People who squeeze, pinch, or pick their blemishes risk developing scars. Acne lesions can form in areas where pressure is frequently applied to the skin. Frequent rubbing and touching of skin lesions should be avoided if you take your acne skin care seriously. Men who shave and who have acne can try electric and safety razors to see which is more comfortable for acne skin care. Men who use a safety razor should use a sharp blade and soften their beard thoroughly with soap and water before applying shaving cream. Nicking blemishes can be avoided by shaving lightly and only when necessary. A suntan or sunburn that reddens the skin can make blemishes less visible and make the skin feel drier for a little while. But the benefits are only temporary and cannot take the place of proper acne skin care. The sun can seriously damage skin, promote aging of skin, and cause skin cancer. Furthermore, many of the medications used to treat acne make a person more prone to sunburn. People being treated for acne often need to change some of the cosmetics they use. Acne skin care demands that all cosmetics, such as foundation, blush, eyeshadow, and moisturizers, should be oil-free. Patients may find it difficult to apply foundation evenly during the first few weeks of treatment because skin may be red or scaly, particularly with the use of topical tretinoin or benzoyl peroxide. Lip products that contain moisturizers may cause small, open and closed comedones to form. Hairstyling products that come in contact with the skin along the hairline can cause burning or stinging in people with acne. Acne skin care products that are labeled as non-comedogenic, do not promote the formation of blemishes, should be used for acne skin care. In some people, however, even these products may cause acne.
The 21st century is best characterized by the advent of ultra-modern technology, global commercial and business, and the unstoppable desire to get and stay ahead. Because of these factors, business corporations compete in a world where the economy is active 24 hours a day, 7 days a week. This phenomenon created a demand for employees that would work even during the night up to the wee hours of the morning. This work schedule reversed employee lifestyle, making the day their time for sleeping. Shifts may disrupt the normal body functions, hamper sleep cycles, and reduce the body's serotonin levels. Serotonin is a neurotransmitter that is found in the central nervous system and impacts multiple functions like mood, sleep, sexuality, and appetite. This neurotransmitter may also promote cell regeneration. Studies show that non-day shift workers tend to have lower levels of feel-good hormones called serotonin. Researchers at the University of Buenos Aires led by Dr. Carlos J. Parola studied 683 men and compared 437 day workers to 246 shift workers. The results, the shift workers' serotonin levels, measured through blood tests, were significantly lower than those on regular day schedules. In addition to reduced serotonin levels, shift workers were also found to have higher cholesterol, hip-to-waist ratios, increased blood pressure, and higher triglyceride levels. Because serotonin levels administer sleep patterns and other body functions, the University of Buenos Aires study suggested that shift work may also lead to a so-called shift work sleep disorder. People with this disorder tend to remain awake when they should be sleeping. These individuals can be very tired during waking hours. This disorder takes place because of a work schedule that takes place during the normal sleep period. Because of this, people who have difficulty getting sleep because their bodies are still programmed to be awake. The time of being asleep and being awake is different from what the body's internal clock expects. Other studies also found out that non-standard and night shift work may affect the cardiovascular and metabolic systems. These studies suggest that there is a possibility that shift work is directly responsible for high blood pressure and increased body fat, according to the researchers of the Buenos Aires study. In addition to the disruption of sleep patterns, reduced levels of serotonin are also linked to other conditions like stress, anxiety, and depression. Lifestyle changes can lead to improved serotonin levels. To make serotonin levels consistent, sleep patterns should be consistent and food regimens should include necessary vitamins and minerals to control the serotonin levels. Certain drugs and substances like caffeine, nicotine, alcohol, and antidepressants should be avoided, because they may deplete serotonin production. Individuals who want to improve their serotonin levels can use medication to aid them in their goal. The amino acid 5-HTP can be taken as a supplement and improve the body's ability to manufacture serotonin. Another amino acid called L-tryptophan is used by the body to produce serotonin. However, before taking these supplements, patients are advised to seek the approval of doctors and other health professionals. Individuals who choose to work in the night should maintain adequate rest to lessen ill effects that may develop. Healthy lifestyles and nutritious food regimens may improve serotonin levels and improve one's quality of life.
Interest in skincare supplements or beauty foods has been strong in Asia, and that trend is growing fast in Europe as well. These nutrient-rich beauty foods make a good case for starting a beauty regimen from within, one that is designed to prevent or reduce the effects of aging, like sagging skin. Some products on the market include a supplement containing lactolycopene, vitamin C, and soy isoflavones. This is aimed at restoring firmness to the skin for women over 40, and was developed by Nestlé and L'Oréal. Others have been developed using lycopene grapeseed extract. Also stops enzymatic reactions that lead to collagen in the skin being broken down. Antioxidants protect the capillaries in skin and thus ensure that enough nutrients get to the living cells that eventually push their way to the surface and become the skin you see in the mirror. They also protect from broken veins and early wrinkling. Capillaries also deliver oxygen to the cells, and remove the waste products of cellular metabolism. This prevents puffy, sagging, and dull skin. But you don't always need to reach for a bottle of supplements. Simply by eating more antioxidant-rich food on a daily basis should see some improvement in skin tone. Fruits rich in antioxidants include blueberries, prunes, blackberries, raspberries, strawberries. And of the vegetables, eat more artichokes, broccoli, red cabbage, Pontiac potatoes, brown onions, asparagus, non-green capsicum, beetroot, spinach, and sweet potatoes. Women are more prone to the damage caused by antioxidants than men, and hence possibly their aging effects. Another strong antioxidant is beta-carotene. Beta-carotene is found in green leafy vegetables, fruit and carrots. This antioxidant has been found to counteract the effects of a particular type of oxygen-free radical, singlet oxygen, which occurs after the skin is exposed to UV radiation in sunlight. UV exposure can lead to premature aging by the effects of singlet oxygen. A study found that whilst the provitamin A aspect the beta-carotene did, it prevented the action of two enzymes associated with UV light and the destruction of the skin cell's extracellular matrix, which happens in premature aging of the skin. Sunlight also destroys beta-carotene in cells after sun exposure, so this beta-carotene has to be replaced. Beta-carotene has been reported as having a mild sunscreen effect too, though it needs to be taken as a supplement to get this effect. The skin care supplement beauty market is still not a strongly developed one, however, as these types of supplements tend to be more expensive than other supplements. And there needs to be more research and clinical trials to prove which products do what they are designed to.
The 5-2 diet is one of the easiest diets and often the one that beginners choose, although it is a little more extreme than some of the other methods, in that you fast for a full 24 hours 2 times a week. Eat for 5 days a week. On the 5-2 diet, you eat normally 5 days a week. For most people who do intermittent fasting, that means that they eat a high-protein, low-carbohydrate diet. However, you can try other methods too. There are plenty of high-carb vegans experimenting with intermittent fasting too, and getting great results. Fast for 2 days a week. On this plan, you fast for 2 days. In this case, that means you fast for a full 24-hour period. Although you can also extend that to doing the full 48 hours once, so that you can just eat the rest of the week without any concern or worries, as long as you're also eating healthy food while avoiding snacks between meals. You choose when to fast. The cool part about this plan is that you can choose when to fast, and you can move the days around too if you want to. For example, on a normal basis, you may choose to fast during the week so that you can enjoy your weekends more. However, if a special trip is coming up and you know you want to enjoy the food, change the fasting days. Lots of flexibility for newbies, as you can see, this does offer some flexibility for the newbie. During fasting times, you only drink water, nothing else, so that you can stay hydrated. When you do eat, you want to eat high-quality food that is low in carbs and high in veggies and nutrition, in the right calorie amounts for your body. Drink water. It is not recommended that you drink or eat anything. But keep in mind that you should pay attention to your body signals. If you feel weak or sick, it's better to eat a healthy 50-calorie snack than to get sicker. However, it is easier to just say no for 24 hours straight for a beginner than it is to do it other ways. If you want to try intermittent fasting, while there are easier programs to use, this one is the easiest to keep track of. Give it a try for a month or two so that you can see the results that it will have on your mind and your body. You can always try one of the other methods once you realize you can get results from this one. Social anxiety disorder. Scared to go out to a meeting to speak to a client? Need to deliver a speech but feel like fainting at the thought of going in front of the class to present? Scared to attend a social gathering for no apparent reason? You might be suffering from social anxiety disorder. Social anxiety disorder, also known as social phobia, is a kind of mental disorder where the sufferer experiences a severe or unreasonable fear of social gatherings, where there is a possibility that one may get embarrassed or ridiculed. Most of the time, these anxieties arise from an intense fear of being closely watched or scrutinized, from the simple things like the way they dress, talk or act, to important job functions like performing in front of a crowd, giving a presentation, or finishing an interview for a job application. This kind of phobia gives sufferers a feeling of being trapped or shut away from the world. They say social anxiety disorder is closely related to shyness. However, social phobia differs in the sense that this disrupts normal socializing functions. It is true that everyone goes through a stage of shyness in their life. Overcoming it is a different thing. When it becomes too much that it interrupts your daily life and relationships to the point where you are sick with worry, it is time to seek counsel. It is good to know the signs and symptoms of social anxiety disorder to be able to determine and treat this said condition before it worsens. People with social phobia manifest two basic kinds of symptoms: emotional and physical. The emotional symptoms include an intense fear of being in situations in which you don't know people, fear of situations in which you may be judged, worrying about embarrassing or humiliating yourself, fear that others will notice that you look anxious, anxiety that disrupts your daily routine, work, school or other activities, avoiding doing things or speaking to people out of fear of embarrassment, avoiding situations where you might be the center of attention. The physical symptoms include blushing, profuse sweating, trembling or shaking, nausea, stomach upset, difficulty talking, shaky voice, muscle tension, confusion, palpitations, diarrhea, cold and clammy hands, and difficulty making eye contact. Basically, this phobia manifests as a symptom of being overly anxious around other people. Sufferers think that other people are more confident than they are, that other people are better than them. They feel uncomfortable being around people, that it makes it difficult for them to eat, drink, work, asking questions, asking for dates, even going to the toilet when other people are around. The good news is that there is a cure for this condition. For the past 20 years, a combination of talk therapy and medications has proven most helpful to limit the effects, if not cure, this mental condition. Certain antidepressants, paroxetine, sertraline and venlafaxine, anti-anxiety medications, and beta blockers are used to help sociophobic people to balance certain chemicals in the brain and minimize panic attacks during periods of heightened anxiety. Talk therapy teaches people with social anxiety disorder to react differently to situations that trigger their anxiety. The therapist helps the patient confront the negative feelings about social situations and the fear about being judged by others. Patients learn how their thinking patterns add to the symptoms of social anxiety disorder and how to change their thinking so the symptoms begin to lessen. To be shy is quite normal. Everybody has gone through a similar phase. Getting past that stage is the difficult part. Ultimately, it ends up to building your confidence to a certain level for you to be comfortable enough to move normally. In case you've been diagnosed as a sociophobic, it is nothing to be ashamed of. With a little bit of therapy, proper medication, and enough support from people who believe in you, you'll slowly be able to socialize and function normally within a group without being too anxious.